Bunion, fun to say, but not fun to have, and here's why. My name is Dr. Nick from Preferred Physical Therapy, where we help people 40 plus stay active and independent, live free from painkillers, and avoid surgery. I'm going to talk about ways to help avoid the development of bunion and Morton's neuroma, two conditions of the foot that are very common and hard to deal with. Bunions are very common and very hard to deal with once they've been let go for so long, and often need surgical intervention to take care of. Dealing with them much earlier on is a possibility and help you avoid all the frustration, pain, and eventual surgery that bunions typically cause. So if you're looking straight down on the foot, this is the big toe. A bunion is on the inside, this big toe joint at the end of the knuckle. This starts to flare out, comes out to the outside, and our big toe starts to bend in towards our other toes, causing this kind of knobby 7-looking formation of our big toe into our little toes. And where this becomes a problem is because every time we step and bend over top of our foot, it becomes more and more painful right over top of this joint. It gets more arthritic, often causes shoes to fit differently. We get embarrassed about showing them off walking barefoot or flip-flop. And so improving the flexibility of our big toe at this knuckle, at this joint, is hugely important to avoid bunions as well as avoid Morton's neuromas, which are irritations of the nerve between the rays of the foot. So these bones here, we have nerve endings that come down and sit in between and innervate these muscles. What happens, we get this compression where these foot bones start to compress more and more, and they cause pain in between here. Sometimes even like a bulb or a knob in between there, and can lead to surgery where they have to go in there and remove it. So this technique I'm going to show you is going to help improve the flexibility of what we call the metatarsals of the foot, which are the bones kind of right across the balls of the feet are. So this technique is very simple, where you just come up into this figure 4 stretch. You're going to bring your fingers of the same foot, so right hand, right foot. We're going to come over top, and I'm going to put my fingers in between all my toes. Putting them in between all my toes, and then with my toes, I'm going to curl down, and I'm going to extend. Curl down and extend. I'm doing this with my feet, my toes. I'm not doing this with my hand, but I'm doing this with my toes. We're going to do this 30 times, nice and smooth. A small pause at the top and at the bottom. So in each position, just a small pause 30 times on both feet. You can do this 2 to 3 times a day. If you're starting to see some advanced progression of either a bunion, which is this toe coming in, sometimes even overlapping our second toe, then spend more time there. You can even bend it out with your hands, get your fingers in between there. If you need more space, use your thumb, and then go down. Give yourself as much gap between your toes as possible to work that mobility. If you have toe spreaders, if you had a recent pedicure, you can use toe spreaders and then just work your toes up and down. Sometimes they come out, so just be aware of what you need to maintain that toe space as well as work the movement of the toes. If you're having pain with any of these positions, just go as far as you can without pain. If you've been doing these for a while and you're still getting the pain, still getting the problems, I recommend you go see a doctor to see about whether physical therapy is going to be helpful for you, or if it's too late and you need to have surgery to repair that bunion. If it's painful, and you'll know, if it's painful every day, all day, no matter what shoes you wear, what footwear you're in, and you're starting to limit how much walking you're doing, you don't go to the grocery store, you're starting to really put limitations on how much you're able to move around, it's time to seek more advanced professional help. This exercise is great for people who are looking to improve the flexibility of their feet. As we age, over the age of 50, we start to see significantly more and more rigidity or stiffness to our joints, and our feet are no different. In fact, I just read a study that showed we lose 6% of our range of motion every decade. So every 10 years, we're losing flexibility. Our toes are no different. The more stiff and rigid our toes are, the more we feel unbalanced, the shorter our step length, the slower our gait speed is, and all these things lead to falls, lead to immobility, and can also cause more joint or systemic pain. This is a simple exercise to help add a dose of prevention to the reality that our bodies are getting stiffer and weaker, and if we don't do anything to intentionally stop that, then we're going to continue to get weaker and stiffer as we go on. Foot strength and mobility are very important in helping maintain our overall health and wellness. So take a look at our foot pain solution playlist for more helpful videos.